It took me a moment. How's it going?
Good. How are you?
Good, good. All
Sweet.
right.
We're going to give everybody another minute to join, and then we'll get rocking and rolling.
All right, cool, man. Just let me know. All right. There we go. Yes.
Hi, Rachel.
Who, me? Yeah, I think because we have Wildcrat streaming for Ori, and then you're streaming. Am I grainy looking to you, Adam?
No, I think you look okay.
All right. Say I'm aged. This pandemic aged me.
All right, I'm ready if you are. You ready
Yeah,
to
man.
I think this is going to be good. There are probably a lot of people joining who up until now thought we were the same person. So
Well, here we
this is
kind of
going to be. I know. That's why it's so confusing.
I know, right? I just got to start wearing glasses more often.
I remember last year at the festival, Ori, who's Dan's son, ran up to me and started yelling "Dada," and then he got close enough to realize that it definitely wasn't Dad, and had a little bit of a panic.
Yeah, he's still scarred to this day of that moment. I was like, the Commodore will not eat you. Do not worry.
Yeah. Well, I thought where we could start, Dan, is with a little bit of an introduction and some background. So for everybody on the call, this is a brief pulse with Dr. Dan, who's the head of MedTent. I'm Adam, one of the executive directors of Breathe, and we're going to try and provide some informative Q&As on the current pandemic. We're just saying pandemic now, right?
It's a pandemic at this point, yes.
All right. So we're going to try and provide some firsthand knowledge for everybody, since that seems to be hard to come by. I don't think it's an opportunity that a lot of people are having on a day-to-day basis. We're just sort of subjected to the ins and outs of the news cycle. So let's start, Dan, with your background. And I think it might be interesting to describe the difference between being an MD and an OD, and how maybe that your take on this might differ from a normal physician.
Gotcha. All right. Well, Mike, you can touch anywhere you'd like on that comment on there. And that being said, actually, it's a D.O. So, yeah, to make it real quick, a doctor of osteopathic medicine is what D.O. stands for. Basically, it's a MD with the ability to do what chiropractors do as well. A D.O. is trained just like an MD residency. It can be a heart surgeon, an ER doc. But we get this extra bit of training and understanding how there's a musculoskeletal like presentation to a lot of chronic disease. So essentially, someone who's got chronic asthma can have findings along their rib cage of chronic asthmatic symptoms that you can then adjust and or come up with exercises and so forth to try to help out. So I'm a family medicine doctor by training, or primary care, and a lot of what I do is like primary care office medicine. I also do about urgent care for about 8-9 years as well. So did a lot of that cross between ER and family medicine or primary care. Additionally, I have some training in something called functional medicine, which is more of the integrative approach. It's essentially the engineering of medicine, looking at the body, but as a bunch of systems, and then figuring out where I can intervene in these systems to create health. So whether it be using exercise, nutrition, supplements, conventional Western medicines, and so forth. So I think going through all this, my practice has evolved and has become very much a unique integrative medicine practice, where I deal with a lot of the stuff that medicine doesn't otherwise have a label for, and then the regular conventional stuff. So my outlook on kind of what's going on is, I think I have more perspective because I just have a couple of different views than conventional medicine. But nevertheless, this discussion will be based in a lot of what's actually happening in conventional medicine as well, since that's the medicine that will ultimately impact our lives. And if anyone's unfortunate enough to get hit hard by this thing, they're going to be dealing with conventional medicine more likely than not. So.
Right. Yeah, totally makes sense. So what, maybe we could describe for everybody what it's been like to feel the change of pace that's brought about in your day-to-day work life now compared to what it might have been just a month ago.
Oh yeah. So, well, about a month ago, it was like just this kind of thing in the background. We heard pseudo reports kind of coming out of China. We had physician groups on Facebook and other places kind of, saying, hey, this is something to worry about. We need to take action. We need to, kind of pay attention to what's going on. But a month ago, it was still kind of like almost a lingering, almost a joke, like the nurses and the ICU people would put up like a coronavirus, but it'd be like have a corona, like, a stupid picture or meme with the actual beer of Corona. Since that time, things have escalated greatly. I think the medical field definitely is in high alert now, and it's really hard to deny what's going on. I think even a lot of people initially were, even like regular doctors, primary care, everyone was just kind of downplaying what they originally thought, thinking, is this a flu? This is just another cold going around, or even is this something like 18 years ago with the SARS epidemic, if anyone is old enough to remember that, which was a similar virus, just didn't have the ability to be passed the way the novel coronavirus that we're experiencing has today. So things have escalated. There's a lot more panic in the communities right now. And, there's a reason. I mean, we do need to be taking precautions, and there is more severe cases presenting at this time, which I'm sure anyone who's listening to this has heard more than enough with the 24-hour news cycle. So.
Yeah. And I think that, when we turn on the news, we're just kind of hearing about some of the worst hotspots in the United States. But my impression has been, and I'm curious to get your thoughts on it as well, is that those are the worst of the worst. We're still seeing a large influx in other parts of the country as well that aren't being quite as hard hit just yet. But I think that that's maybe something that you're starting to experience is preparing for whether or not Chicago is going to be the next hard hit area of this.
Yeah, so a little bit of background. The coronavirus or the COVID-19 virus comes from a group of viruses known as it's a beta coronavirus. This is what we call a subgenus of like the SARS, or the severe acute respiratory syndrome, that was experienced back in China. A really severe flu, if anyone remembers, that would like scar lungs and so forth. This virus was identified in Wuhan, China, back in December of 2019, and since that time, the amount of cases has started to just rise exponentially. To put it into perspective, just from my area of Chicago, I went from 2 weeks ago hearing about one case here and there, having one patient who I knew had it at the time, to now having 7 or 8 patients, and that's just in an integrated medicine practice. The ER physicians who I'm friends with went from one positive case in the ER, 1 in 10 positive cases, to now having 9 of 10 positive cases. Mm-hmm. So this is a virus that it's one of those things where it's this weird thing in the background. You hear about it, you get to be a little paranoid about it, and then before you know it, you're in it. Yeah. It's a 14-day lag. So what we're seeing in New York will be in Chicago within the next 10 days. what we're seeing here, well, then it's just going to kind of always look at that as the pattern. So there's about a 10 to 14 day lag for how fast symptoms build. And one of the big things with how the transmission goes is because it's so easily transmitted, which we can discuss, one asymptomatic person transmitting before shelter in place or social distancing started could easily infect 10 people a day. So if you kind of look at the rise exponentially, we're kind of, we're behind the eight ball, if you will, in what we're trying to do. But we actually, in Chicago now, there's some new data that says we flattened our curve a bit, which we'll discuss a little bit more. So
Cool.
It's exponentially increased, and definitely it's we're coming into, at least in Chicago and in New York, obviously, this is the hardest times are amongst us and coming right now. So, and I'd say the next 2 weeks.
Yeah, for sure. And it seems to me like maybe it's just taking a while for everybody to understand that this is quite different than normal seasonal illnesses that we might experience. So could you talk a little bit about why this is so much more serious and we're taking such greater precautions than a seasonal flu, for example?
Sure. First let me start, like, is the message I kind of sent out to people is, like, the current mortality rate in the very successful countries. So, like, if we're thinking, like, am I going to die from this? Okay, let's, like, talk the reality. Chances are anybody who's under 65 with with no current morbidities or issues like healthcare issues, your risk goes down greatly. So there will always be those crazy things we see on the news, like this teenager got it or this infant got it. But the reality is that the high mortality is greater than 70 or greater than 65 with pre-existing lung conditions, diabetes, cancers, immune compromised, those are the people we really want to worry about. And there's a lot of those people in this country. And that's why it's so significant, because everyone in their life probably has a person in their family who will meet the demographic of high risk. And that's the people we need to protect the most. At this time, like if you're younger than 20, even your risk is still in that 0.2 to 0.4% mortality rate. So I mean, it's like it's there, but to put it in perspective, influenza is 0.2. So if you're at a 0.4, you've almost doubled your mortality rate. So it sounds low, right? Of a 0.4% mortality. But when you think about 0.2 in the flu, you double that, suddenly that is kind of a big deal, right? If you talk population and mass. So that's why we have to worry, and why we as the Breathe community need to really do our part in practicing some of the things that are talked about in the news and that are legislated by our states and federal government. Because we do have, by sitting around and doing nothing in our homes or whatever you want to do in your home, I shouldn't say sit around doing nothing, we have the potential to save a lot of lives, which is really weird to feel like staying back and doing less will help out. In regards to kind of, and I just go through a little bit of like what flu versus coronavirus, they're two different like viral families, but they present similarly. So some of the things you would see and some of the common kind of, what do you want to call it, symptoms, and are fever, overwhelming tiredness, lack of appetite, body aches, shortness of breath, and like sputum production. Those are your big ones, which sound exactly like flu, right? So the other weird things is there's some other odd ones that have been thrown around the communities. Loss of smell or taste actually is something that's been a phenomenon with this virus. Can't really be explained, but definitely seen one patient who lost their smell or taste who tested positive, but had otherwise not many symptoms. That being said, it's like I can kind of dive into some of like the chances of presentation and the realities of what we're hearing about like the asymptomatic carriers.
Yeah, go for it.
And slow me down if I'm kind of going all over the place, okay, guys? Or feel free to ask questions. What's typically known, and again, this is right now, things change day to day with how fast this stuff moves, is that the average the incubation period for coronavirus, and the reason why they say isolate for 14 days is that that's the maximum amount of time after exposure symptoms will develop. If symptoms are going to develop, the average time to develop is about 4 to 5 days. So if you're going to get any symptoms, that's about the average time you want to wait. You know, it's about 81% of people will have mild to no symptoms at all is what they're clocking right now on the epidemiology charts. So that's pretty amazing to think like, okay, this thing's taking over the world, but 81% of people will actually have nothing going on.
That's a big chunk. So does that mean that a majority of us could ultimately end up infected but not sick?
Exactly. And I kind of think a lot of people will end up infected and not sick. And I kind of think a lot of us have already been. The thing that we're like kind of dealing with right now is that we don't have an adequate infrastructure in place to really know who's been sick. So the thing that I really hope happens, and I think we're behind, but it's probably going to happen in the next 2 weeks or so in the communities you'll see, is just mass testing. Right now, if you do get like tested, right, or you want to get tested, it's not an easy thing to figure out. I don't know if any of you guys out there listening have like asked to get tested or gone through the hotlines and so forth. Singapore as one of, and like South Korea are both places where the mortality rate's been held down to 0.4%, but they are the ones who identified with SARS early on. So I see there's some questions rolling in. Keep those. I don't know if Adam, if you can keep some of those to the sides.
Yeah, this is a good time to pause for a second. So if you guys do have questions, drop them in the chat box. I'll pick them up and then feed them into the conversation as time allows. So definitely keep those coming if anybody watching does have questions for Dr. Dan.
Yeah, we'll definitely have a place to address. We'll address them for sure. So that being said, the places with the lowest mortality rates truly flatten the curve. So if we could literally have testing in place on every street corner, you went in, you got tested, you were told you had it, even if you were asymptomatic, you isolate for 14 days and we can put the fire out very quickly. It's unfortunate that we just don't have that ability. So if you're gonna feel symptoms or you have any fear, most communities right now have hospital setups where you can call a COVID hotline to figure out if you want to if you qualify to get tested, right? Current recommendations for testing are very priority based, meaning, you know, if you say you reside in a place where there is a lot of coronavirus, so you're in New York, they can't track how the spread is happening anymore in New York. There's just too many cases at this point. So now if you get sick, flu-like symptoms, do you qualify to get tested? Well, testing is so limited that it becomes priority. So if you're sick, but you're not that sick and you've been exposed, chances of you getting tested will be very low in our age demographic and who we are. So at this point in time, we probably wouldn't qualify. So the best thing we could do is follow the non-testing isolation rules. Which I can provide to you if you like want to hear. Basically, if you've not been tested, but you suspect, and this is, I think, a kind of an important thing for everyone to hear. If you haven't been tested and you suspect you've been exposed and had symptoms, the criteria for going back out into public is it adds up to about 14 days. But what you want to do is you want to wait 7 days to your first symptoms pass. So fever, body aches, 7 days after your initial symptoms resolve, and then 72 after those resolve, then 72 hours after that is full recovery. So it's a weird way of putting it, but what you want to do is, I'll rephrase it. Basically, when you get your first symptoms and 7 days have passed, people typically have some low-grade fevers, and they're basing the criteria right now on like fevers. So what you want to do is you don't want to take any more fever reducers, Tylenol, ibuprofen, and so forth. And you actually want to measure your temperature for those 72 hours after your symptoms have passed. If you're fever-free for those 72 hours without taking any medication, then you can reasonably assume you are no longer contagious to the outside world, if you will. So,
yeah.
And I think that's very important to kind of follow, since testing isn't as available as we'd like it to be.
Sure. One of the things that I've been curious about is this hesitancy to test unless they think that it might impact treatment. So I'm kind of confused by that, because how is that if you test positive, it's going to impact how they decide to treat you, or is it just an isolation thing?
So that's the big thing. It's like it's mostly isolation. If your priority testing goes to hospitalized patients and symptomatic healthcare workers, so they don't actually have so they can't spread it. So the only way it will change treatment is if you are considering using an antibiotic, if the patient is in critical condition and you need to figure out how you're going to support them through their symptoms, or if you need to isolate them. So in early detection and isolation is the key. The rest of it is for management within a hospital setting, and also to understand the risk of the patient who may be staying at home with comorbidities such as diabetes and or immune compromised status.
Okay, cool. Yep, that makes sense. Because it does seem like, uh, for example, I developed a lot of the symptoms, but they basically said, "Oh, you're not quite bad enough for us to test you." And one of the things that you and I talked about that I think is interesting to bring up for the group is our inability to judge just how fast uh, the virus is progressing, or our ability to flatten the curve if we're not doing regular testing.
That's the hardest one. So can you kind of rephrase kind of what the question?
Yeah, I'm curious to get your thoughts on the timeline where we're going to be able to roll out mass testing so that we can have a better approximation of whether or not the social distancing and the other precautionary measures that we're putting in place are having an impact on certain communities.
Gotcha. So my prediction is that in 2 weeks there will be mass testing. I could be wrong, but the way it's going right now with our clinic is we are trying to acquire basically testing that will get done in 10 to 15 minutes. Abbott Labs is basically revved up production of their first testing kits. So the ability to get tested at like a Walgreens or a drive up, I think will be here in two weeks if the infrastructure holds up.
Mhm.
The other idea, though, is that's this. How do I put this? So in 2 weeks we'll know, but we don't want to not social distance or follow the guidelines within 2 weeks. There's some new data in Chicago that shows that the social distancing is beginning to flatten the curve and has downtrended the COVID virus spread.
Mm.
So at this point, I think the social distancing is probably going to go on for the rest of this month easily, and then it's going to slightly ease up after this upcoming peak. But I think it's going to be staggered across the U.S. So I think it's going to kind of, it came from New York, it's kind of spreading through Ohio, it's Chicago's the center. So it's going to kind of like hit Chicago in the middle, LA, New York, and then it's going to meet back in the middle again. So everything's going to be staggered by a couple weeks, but I think that right now we know social distancing is slowing the curves with some of the data, and mass testing will be available, I believe, in 2 weeks from Abbott Labs and another lab out of China. And these will be blood spot testing, so you know if you've had the actual virus, because that's another thing. If you know you had it, which there were some questions rolling through, then you can safely go out. The question of reinfection, because that kind of leads into that, is
Yeah.
that there are two types of coronavirus, COVID-19, that we know of. There's an L type and an S type. The L type accounts for 70% of coronavirus, and the S type accounts for about 30%. So this idea of reinfection right now comes from the fact that there just are two versions of the virus out there,
Mm.
but I can't find any real data on like being reinfected by the same viral subset type. So getting reinfected with the L type is highly unlikely and not confirmed or denied at this time in the journals. But most of the current IDSA thinking, the Infectious Disease Society of America, is that you're not going to get reinfected with the same viral type.
Hmm.
So,
Cool. I wonder if we could just spend a minute on sort of antibodies 101. Maybe this is more virus 101, but could you talk about how our bodies respond to a virus when they do run into it? Because one of the ideas that's being floated is this antibodies test to evaluate who might have already contracted the virus and who's developed the proper antibodies, and using that as sort of a guide to ease social distancing in the future.
oh God, you opened up a can of worms with that one, dude. This is my favorite stuff. So in short, antibody testing, when your body is exposed to a virus, you have three immune systems, okay? You have something called your innate immune system, which is kind of your protective immune system. It's the immune system that's on your the surface of any part of your body that's going to communicate with the outside and bring something in. So in your nose, the mucosa or the tissue has an innate immune system. Your stomach has an innate immune system. These are the things where if you're exposed to that virus, they're going to try to clean it up and identify it very quick. So it will lower the viral load getting into the body. Once the virus gets into the body, and the reason why COVID is so dangerous is because the main receptor that COVID uses to infiltrate a human cell is predominantly in the lungs. It's called an ACE2 receptor. So that's why it gets to the lungs so quickly and so easily, because that's the high concentrations of the receptors it uses to get in. Once you're exposed, your body then takes something called the Th1 immune system, finds that viral particle and presents it to these things called B cells in another section of the immune system. These B cells then create an antibody to the virus itself. Mm-hmm. And then the antibodies are charged with identifying and grabbing onto the viral pathogen and or cells infected with the virus to elicit more of an immune response. So the testing that's going to be out in the next couple of weeks, and they're actually, some of the labs are doing internal validations of this, is serum antibody testing, which will test for these antibodies called IgM and IgG. IgM antibodies are your acute phase antibodies. If you have an IgM antibody, you're probably fighting an infection. IgG antibodies are memory antibodies. They're the guys who provide your memory. They're your memory of your immune system. So like when you get your shots growing up, vaccines, if you do get vaccinated, those are what you get to protect yourself. So then your immune system can identify, it can respond more stealth-like to an infection, and then you don't have as pronounced of an immune response. So in regards, I can kind of answer a little bit about the immune boosting stuff and so forth. I was kind of scrolled through. The thing that's happening with like really bad cases of COVID-19 and this idea of acute respiratory distress syndrome, or ARDS, is an overactive immune response. So your immune response is dictated by how your genes, certain genes express themselves. There's a gene called NF-kappa beta, which regulates the expression of the two inflammatory molecules that are kind of like the head honchos of the inflammation game to activate the immune system, get things going. Something called IL-6 and TNF-alpha. So I'll try not to get too heady, but it's like my favorite stuff. So a lot of the rheumatologists use these drugs that inhibit IL-6 for rheumatoid arthritis. And really cool, they're looking at some of these immune modulating drugs to try to prevent really high-risk people from developing ARDS by inhibiting IL-6. Really cool herbs and so forth that help lower the expression of NF-kappa beta and thus making your immune system less likely to go overboard or too crazy, are things like curcumin or turmeric. Another guy is resveratrol. That's like the good stuff in red wine. The idea being, though, is sometimes you want to moderate, right? So you want to have just enough inflammation. You don't want to suppress it too much, and you don't want to have too much. So that leads me into another little nugget. Right now, there's this debate in the medical community, and the main idea is that, well, do I use Tylenol or do I use ibuprofen to suppress my fever, to help my body, with the inflammation, right? Right now, there's a belief that NSAIDs like ibuprofen, Aleve, to name the two big ones, they can actually predispose you to having a worse ARDS or a worse infection because they inhibit all of your inflammatory markers. So then you can't mount a good enough immune response to fight the COVID fast enough. So that causes more damage to the lungs. This is not substantiated in literature yet, but the current guidelines is to recommend Tylenol or acetaminophen over ibuprofen if you do have like the flu-like body aches, fever, and you're looking for something to like help those symptoms. So the theories there's some case reports, about 6 case reports on the whole idea of too much ibuprofen, but my current go-to would say acetaminophen. The red wine comments that are coming through, unfortunately, to get the dose of red wine to the resveratrol dose that you're looking for to inhibit NF-kappa beta, you have to drink, I calculated out, 9 bottles of red wine a day. So good luck, Rachel. It's gonna be a very expensive pandemic. That being said, not to go too far off stream, just a lot of what people do for themselves, especially in the Breathe community, eating an anti-inflammatory diet, like broccoli itself has a lot of things in it that are really helpful to regulate the immune system. These are all just like healthy ways. So if you just type in anti-inflammatory diet, you'll find everything you need. For initial support, since I'm just kind of on this tangent for the moment, there is actually some good data on 3 things, and this is not meant to be medical advice. It's what I do, but if you have any pre-existing medical conditions and you want to know like more, or you have questions, sometimes docs will know it, sometimes they won't. Vitamin D, so if you've ever been told you have vitamin D deficiency, vitamin D does help to modulate the immune system in such a way where people who have adequate vitamin D levels don't get as sick with flu-like symptoms or colds as people with low vitamin D. So if there's a suspicion and you don't want to do too much but don't want to do too little, about 2,000 IUs of vitamin D3 up to 5,000, so 2,000 to 5,000. Vitamin C actually plays a huge role right now, and I saw a cool meme in the Facebook groups that I'm part of. Someone takes 10 grams of sugar and like a bottle of Coke, no one blinks an eye, but you tell someone to take 10 grams of 10 grams of vitamin C and everyone freaks out. Like it was like a Joker, like from Batman. Vitamin C at even 2,000 milligrams per a day, it's an antioxidant. What it does is if there's a fire, it quells the fire. There is some data out of China that shows that taking vitamin C regularly right now it'll help with the inflammatory process and keep inflammation that would be otherwise caused by the virus in the lungs down. If you take too much vitamin C, though, you will get diarrhea, and blame me. So the typical max dose before diarrhea of vitamin C is about 6,000 milligrams in most people, or 6 grams. So I typically would just say, to play it safe, 2,000 milligrams twice a day for best absorption if you're looking for a protection or looking for just a little bit of an idea of how to strengthen your immune system in a low risk way. And then the last thing is zinc. Honestly, these are like just the low hanging fruits. You all heard of zinc helping with the common cold? Mm-hmm. Zinc at 15 milligrams to 30 milligrams per day right now would be more than enough. I would say if you're healthy, you eat lots of fruits and vegetables, stick to the 15 milligram marker. If zinc is an antiviral, it will inhibit viral replication as well as it can be viral acidic, and that's why it's touted. Do not use nasal spray zinc like Zicam. It can affect your smell, and if you're going to lose your smell from COVID anyway, it comes back, just so you know. Don't be spraying zinc into the nose. And if you decide to take zinc for long term, be sure that your multivitamin or something that you're taking has at least 1 milligram of copper, if you want to be safe about the zinc stuff. So those are the big stuff. And then I got one more, and then we can kind of move on to some other stuff. There's something out there called N-acetylcysteine, or NAC, NAC. NAC is this thing, it's a precursor to something called glutathione. Glutathione is the primary antioxidant in the body created by the liver. Put into perspective, glutathione clears alcohol from our body. So when you guys are trying to get your resveratrol, about 10 bottles of wine a day, be sure you're taking your NAC so you don't get hungover. what we found is that NAC at 500 milligrams twice a day will protect your lungs from all sorts of things. It was but influenza and SARS studied with NAC is actually been shown to reduce lung inflammation and damage. So it's really quite a good thing to have on the shelf. So if you are an asthmatic out there or have some other issues like that, then consider looking into NAC. Obviously, talk to your doctor. It's pretty low risk in the grand scheme of things for a supplement in itself. So those would be my typical, and there's a little bit more for questions later that we can discuss, because there's obviously some other things. So
yeah, I think that's great. I know we've started doing zinc and turmeric and vitamin C and D, and then I think that there was also a mushroom complex that you had recommended as well.
yeah, so mushroom complexes. So you remember that part of the innate immune system I was telling you guys about, right? The innate immune system, if you can strengthen that enough, then you can really knock out the virus before it even does anything. So my opinion of why a lot of people are asymptomatic is that they have otherwise very strong innate immune systems, and they clear a lot of the virus very quickly before it becomes an issue. So you'll typically see something called 1,3 beta glucan, GLUCAN. These are either derived from reishi mushrooms, or what's the other big mushroom? There's one other one that I'm missing, I think lion's mane, and God, I wish we had our mushroom guy here. So those are the two big ones. Also, there's a yeast out there called Saccharomyces cerevisiae, which you would see as another one. Basically, these compounds strengthen the innate immune system. And they prevent it from going overboard, but they also strengthen it. They provide balance. What's Breathe all about is balance. So you use those mushrooms to help the innate immune system. One thing I want to caution, though, is that in the integrative medicine world, we don't actually there's a lot of stuff being thrown out and from every which way. Everyone's claiming they know exactly how to go through the process. And my big opinion is balance, right? So if you're going to be doing your mushrooms, get your turmeric on board as well, because you don't want to overly strengthen your immune system. And a lot of us have really strong immune systems anyway. So immune regulation and balance is more important than trying to up your immune system right now. If you guys have read anything or know about elderberry, it's a very common purple tasting thing that you can find in every store. If you overdo elderberry with a very strong immune system, you can actually increase your immune system to a point where you might develop an acute, a cytokine storm, if you've heard the term yet. Cytokine storm is where the immune system goes crazy. So that's kind of why I always just kind of say, remember the balance. And if you're going to do these things, it's always good to practice that balance and not think I just need to beef up my immune system for right now. Honestly, the best way you can beef up your immune system is do whatever you can to decrease stress, which is not easy right now. So obviously everyone out there probably has their own way of decreasing stress at this moment in time. Getting rid of the cortisol will inherently decrease the chance of a cytokine storm. And cortisol is a stress hormone that we secrete when we're very anxious all the time with the 24-hour news cycle.
Yeah.
Also, I got one other one. Also, adequate sleep. Believe it or not, melatonin is one of the most anti-inflammatory molecules in our body. And if we get adequate 8 hours of sleep, our melatonin rises and falls in such a way where it modulates inflammation really well. So it's kind of stress and sleep are our other two big defense mechanisms. So
yeah, cool. I think that's all great. One of the things that we've been running into as an issue in Colorado, outdoors is such a big part of people's lifestyle here. The parks have been flooded, the open spaces have been flooded with people, and it's great to see everybody outside, and trying to take care of themselves. But it seems really hard to do the proper social distancing and getting, some exercise and some outdoors time at the same time. I think that's all something that we're probably going to struggle with for the next couple of months.
Oh, for sure. I mean, I honestly, man, I just try to walk out the door and go for a run. I cross the street when people are coming by. You do whatever you can. And I can't imagine being in Colorado and where everybody's stress mechanism or stress relief mechanism is something physical,
Yeah.
There is the CDC said everyone should be wearing masks now. You guys, probably a lot of you saw this. Masks will help prevent some of the viral spread, but it's not a substitute for good hand washing and like not touching your face, essentially. And they've actually okayed bandanas as well as scarves as part of the masks, just mostly because there's not enough masks to go around for the healthcare workers at the front line. But it's worth following that recommendation regardless. And you know, if you got your breathe buff, it's a good way to promote.
Yeah, definitely.
Maybe we can get a Breathe N95 mask. Anyway.
So I think we kind of touched on it already, but one of the questions that came in was, can I get COVID-19 more than once? Am I susceptible to getting sick a second time if I've already been sick once?
There's debates out there, and I've heard like the reports and so forth, but so far the medical as far as I know today or yesterday when I looked, because I wanted to try to figure that out, it has not been validated outside the fact that there are the two strands of the virus going around, unless I haven't seen some other piece of literature out there that I haven't been able to read yet. So in my current state of knowledge, you probably won't get it again, and even if you did get it again, it would be a lot milder. I guess the only thing you would worry about is respreading. Which brings me, well, yeah, one last thing I wanted to bring up about that. So if you get like a really, just like what we call it, mild symptoms or a mild illness, the typical recovery time is about 2 weeks. And they think this time you're able to spread virus for is about the same time. If you're really severe, they've seen viral shedding up to 3 to 6 weeks in people. But severe is like you'd be hospitalized, you'd be very hard to breathe. You'd have to undergo some kind of other medical intervention. So. Mm-hmm. I know, so much shit. Excuse me. Let's see, what else did I have in here that I wanted to help you guys out? I know, there was a question on what was it? The lasting in the air and on surfaces.
Yeah, let's touch on that.
So I had looked it up because I wanted to know what the reality was so far. In lab testing, I'm going to walk over so I can get plugged in on another spot. In lab testing, they have found the virus could exist theoretically on plastic. Hold on, I'll have to for about 6 days. But this is in a lab test, and they weren't like, exactly, hold on one sec. I just got to get to my phone might die.
That's all right.
Hold on. Oh, do you have it? All right. Yeah, let me just get I got my kid running around. So, sorry. So some of the big things is, so they found they were able to make it live for about 6 days on plastic. From what I've heard, 2 days on corrugated like cardboard. And then they think 3 hours in an aerosolized like environment without a lot of wind. So they do think now, hold on one sec. Hey, say hi to everyone real quick. Say good night.
Good night.
All right. All right. So basically, we got 3 days, 3 hours aerosolized is the theoretical right now. It could be up to 6 days on plastic. This is my own personal opinion, but I think Amazon might have spread a little bit of corona between you and me. Maybe something FedExed over from, anyway. So yes, it can live for quite a decent amount of time, but it is what you call finicky, right? So if you were to leave your groceries in the car, like canned foods and so forth, for 2 days, it would probably not be on that can in 2 days. Does that make sense? So there's a lot of arguments. I don't have it all sorted out yet. Typically what my family is doing now is, because the mask thing is there, we're wearing a mask in the when we go shopping, as well as gloves. However, I just do hand sanitizer because everyone's touching product all the time anyway. Yeah. When we get home, we just have one space wiped. We just empty the groceries at that spot. Anything perishable, we just wash in the sink. We clean off the spot where we set all the bags down, or we keep them on the floor and then clean that spot off. It might be a little bit more paranoid than you have to be right now, especially for our demographic of people that we're kind of talking with today. But that's kind of the the more conservative recommendations. And, you know, up until maybe a week ago, I was not as conservative, just because I kind of think we might have already had it in our, I think I might have already had it in our house. So we'll see, have some testing pending. So let's see. I think we're at a point where, Adam, do you have any other thoughts, or we could answer some more questions and so forth?
Those are all my questions. So if anybody has any more, drop them in the chat now. If not, we'll just start to wrap things up. So I'll just want to summarize real quick, Dan, my current understanding for how we can all be taking care of ourselves and of our loved ones, and the people that we're living with. You recommended some great immune boosters. Maintaining the social distancing and adhering to state and federal guidelines seems to be quite important. And in your opinion, are CDC guidelines still the best place to go for those resources?
Yeah, and yes, it is, because I'm a naysayer, and I'm very much a what do you call it? You know, I'm a little bit of a conspiracy theorist and so forth. But at this point in time, they've convinced me. I do believe, from what I'm seeing in the community, that following CDC right now and the social distancing practices is what we need to do, so we can support our loved ones and the people who we might otherwise lose to unnecessarily to this kind of thing. So that's I think the biggest takeaway, is that, like, we should be following it. We're pretty strong, pretty good group of people, and doing our part is basically following the current recommendations, and listen to the healthcare providers, the CDC. Avoid listening to the talking heads. Don't even pay attention to the legislative branch of government. Just pay attention to the healthcare workers right now, because they're going to be the ones who are going to steer us straight. And the other thing is, I think that in the next 2 weeks here, we're going to see kind of the crest of the wave. And as the crest hits, we're going to start watching things go down into May. I think May still will feel a little claustrophobic with social distancing, but they're going to start experimenting then with probably laxing on it. Okay. The other thing, if I'll share with you, I don't know, do you know where we're at on time, Adam? I don't want to go too far over.
You're fine.
Excellent. You know, China, we have a couple of friends who teach English in China, and we got an update. They actually got to go back to Shanghai, and they told us what it took to get back into that country. All right. So this is why this is one of the things that made me believe that it was something we were going to have to pay attention to, is that when they got back into Shanghai, just had to get my charge in. Okay. When they got back in Shanghai, they had to stay at the airport. They had to draw blood. They each got tested. 9 hours later, they were deemed corona-free. They were then shuttled down these ramps that were made for people coming back into buses specifically for people entering the country. They were brought to their apartment. They were escorted by the police into their apartment. They were then gave one volunteer to get food and other provisions that they would need for 14 days of quarantine. A doctor came over every single day to check their temperature and do a physical exam and draw blood every third day to see if they would test positive. So you look at that kind of I know it's draconian, crazy, you know, it's wild, right? But you kind of wonder, it's somewhere in the middle of not caring at all and still going to social gatherings right now and not caring, and draconian measures in China to stop the spread. So it's always in the middle somewhere, guys. You know, everyone, we're all about middle ground. So to me, that kind of signaled, hey, we got to take this a little bit more seriously, and not just assume it's a flu that we're all just going to deal with for a while. It's a little bit more than that. So.
Yeah, no doubt. And I think one of the things that I wanted to get across to everybody during this conversation was just how serious the situation on the ground is, because for those of us who are working from home and have less exposure to this on a day-to-day basis, we're not on the front line seeing just how bad it is. So I think it's really valuable to hear from the healthcare workers themselves and hear about what we should be doing to help ourselves, but also help the people who are having to deal with this day to day.
Yeah. Oh, well, yeah, that's a good point. Day to day, I mean, if you guys have any PPE that you can donate, so protective equipment, masks, specifically N95. If any of you guys are like graphers, spray painters, you got, those like the ones you can get from Sherman-Williams. Call the local ERs or the people who people around, because we don't need N95 masks. We can risk going out with a scarf or breathe buff, whatever. What we need to do is supply our first responders, the people who are going to be intubating those who are extremely sick, sticking tubes down people's throats. They're the ones who need those masks, because those are the people who will run thin on. And like one of the things I'm doing here is I've set up a drive-through COVID site at my current clinic, but I'm going to run out of swabs by the end of this week easily. So I don't know how long I can stay operational for unless these other tests come through. So any PPE gear is of utmost like importance to anybody at this point in time. The other things, and then obviously just social, it's weird to say, but social distancing, and try not to hurt yourselves. Abby actually slipped and like sprained her thumb down the stairs, and we were like, oh shit, is it broken? Luckily I have an ultrasound machine now. So I was able to tell it wasn't broken, but we were worried about a skier's thumb. So try not to get hurt during these times, because we don't want to flood the ERs with, you don't want to go to the ER first off, and you don't want to flood the ER with just other stuff, if you will. So that would be one of my other recommendations. So, oh gosh, guys.
That's great. Yeah. And definitely applicable for our community as well, just to be cognizant of that.
Totally. Let's see. I'm trying to think if I missed any other questions. Does anybody have any other questions at this moment?
I think we got them all. This was a good bit of information. So thanks, Dan, for doing this and letting everybody have that opportunity to ask questions from a medical professional. I think to wrap it up, we would just say, make sure you're taking care of yourselves and still doing what you can to care for your mental health. If you're struggling, reach out to people you trust or to the appropriate medical professionals, and do what you can to limit this so that we can get through it as quickly as possible and make Dan's life easier.
Thanks, guys. And please, if you guys do want to reach out, I could give you like recommendations and so forth. I'll do my best to get back to you. Obviously, I've been kind of it's been really busy, but I definitely will do my best if anyone had any like more specific questions. Okay.
Sweet. Thanks, Dan. You're the best.
No problem, guys. You take care. Bye, everybody.